Hi, I'm Tom Kosztowski, one of the neurosurgeons at Texas Back Institute. Today we're going to be talking about spinal stenosis. So what is spinal stenosis? Well, spinal stenosis is essentially narrowing of the spinal canal. So if you look at this model here, so this is kind of looking straight on at the spine, okay? The spinal canal is this area right here, okay? And it contains the spinal cord itself and the spinal sac containing all the nerve roots. So when we develop spinal stenosis, what occurs is that the spinal canal itself gets narrowed down, compressing on either the spinal cord at that region or the nerve roots, depending on what level of the spine we're talking about. What causes spinal canal stenosis? Well, there's a lot of different things that can contribute to that. So in front of the spinal cord or spinal sac, the thecal sac, you have the discs. So disc herniations, major disc bulges can contribute to some narrowing. On the sides of the spinal canal, you have the facet joints or the joints of the spine. And as we get older and develop wear and tear, these joints can develop bone spurs, or sometimes they can develop cysts called synovial cysts, which can be compressive. And then lastly, from the back of the spinal canal, you can develop overgrowth of ligament called ligamentum flavum. So as we get older, all of these wear and tear changes occur, and slowly they cause narrowing of the spinal canal. And when the spinal canal gets narrowed to a critical amount, we can start to have symptoms. What are the symptoms of spinal canal stenosis? Well, there's a wide variety of symptoms that you can develop, and it also depends on what part of the spine we're talking about. So for example, when we're dealing with spinal canal stenosis in the neck, people can develop shooting pains into their arms. They can develop numbness and tingling into the arms. One of the more concerning symptoms is what's called cervical myelopathy or sick spinal cord. And in that situation, patients will start to develop symptoms of clumsiness with their hands or clumsiness with their walking, but they can also have headache symptoms. And oftentimes the pain that people are having doesn't necessarily correlate pinpoint to where the problem is. So it's very common that people who have cervical stenosis, neck problems, are going to also be complaining of pains that are going up to the head or headaches. So neck problems can manifest as headaches. In the thoracic spine, or this mid-back region, spinal canal stenosis will be causing compression on the spinal cord itself. So this can result also in mid-back pain, and then it can develop also or result in symptoms of leg problems, such as numbness in the legs, weakness in the legs. And then lastly, in regards to the lower back, spinal canal stenosis can result in symptoms of shooting pains down the legs, low back pain, numbness in the legs, tingling. It can also result in weakness in the legs, and occasionally in bowel or bladder disturbances. Your doctor is going to ask, are you having difficulties walking long distances? Do you find yourself leaning on a grocery cart? These are very classic signs of what's called lumbar stenosis. So what do we do about this? Well, first off, we always want to understand the problem. Okay, so we'll do a diagnostic workup. Ideally, an MRI will be the ultimate test for us to understand what's going on. And if we can't get an MRI, we'll get a CT myelogram. But you might first get tests such as X-rays or maybe even a CT scan by your doctor. Now, in regards to the treatment, we don't just always rush to surgery. In fact, we oftentimes, vast majority of times, will want to exhaust conservative measures, and conservative measures can be effective and successful in many situations. So conservative measures include medications for symptom relief, physical therapy, and sometimes injections can be quite effective as well. Okay. Now, when these conservative measures fail, or if they fail, then we talk about doing some sort of surgery to alleviate the symptoms and solve the problem. And here we're dealing with a physical problem where there is narrowing of that spinal canal. So the goal of surgery is to open up that narrowing, to decompress the nerve roots. Okay? And oftentimes that could be as simple as just doing a decompression. And now decompressions used to be done open, midline, larger surgery. These days we're doing this minimally invasively, either through tubes or with endoscopes. So these are oftentimes surgeries that can be done very effectively, very minimally invasively, with the patients going home the same day. Other surgical options that one may consider or discuss when treating spinal canal stenosis are things like fusions, especially if there is some concern of instability or major slips in the spine. Depending on where the pathology is, for example, if there's a major disc component pressing on the spine, then your surgeon may talk to you about an artificial disc replacement. So when should you see a spine specialist in regards to the symptoms that you might be developing with spinal stenosis? Well, I would say once the symptoms get to the point that you're starting to really have a hindrance of your quality of life, you should definitely see someone. Also, I mean, if you start to develop neurological signs that you're developing weakness, numbness, problems with controlling your urination and stools, then you would want to immediately seek help for this. So if you're experiencing these symptoms or have any concerns of this, I encourage you to call Texas Back Institute, and I'd be happy to evaluate you and educate you about the problem and figure out a treatment solution for you.